In this tutorial, I am going to discuss on what is called cardiac tamponade. What is cardiac tamponade? Cardiac tamponade is actually a complication of a condition that we call pericardial effusion. What is called pericardial effusion? Pericardial effusion is actually a collection of free fluid around the heart in a cavity or in a space that is called the pericardium. So you can actually see here that there is free fluid. This region that we have here is what we call the pericardial space or the cavity. So the pericardial cavity that we have here. So this is our heart. So you can actually see there's a disfigurement or disorientation of the normal architecture of the heart here. So here the heart is actually compressed by this free fluid. So when the heart is compressed or the heart is under pressure because of the tension caused by this fluid around the heart, we then have a condition which I am referring to as our cardiac tamponade. So this is the heart in tamponade. You can actually see that the heart is floating and it's a troubled heart. So this is not a complex echo examination. It's actually a very simple examination that every sonographer must be in a position to do. So we just need to identify if there is free fluid around the heart and if it is having any sign or any deformation or distortion that is causing to the normal function of the heart. In which case you can actually see that our heart is having chaotic flow, so movement, it's not moving in the normal excursion. So when the heart is actually floating and is under compression, it loses the normal excursion, or the heart is not contracting as much as it should be. Looking at this, you can actually see here is our nice heart. You can see here is our left ventricle, and then we have got our nice mitral valve, the cusps here, and we have got our left ventricular outer tract here, and we have our nice right ventricle here, and then our left atrium is somewhere here. Interventricular septum is intact, but we have got free fluid here, what I'm referring to as my pericardial effusion. So doing it this way again, you can actually see that the troubled heart is actually swimming in this here lot of free fluid or in the pericardial effusion. So you can see this is the heart and it's actually swimming. So this space that you are seeing here is the pericardial cavity, and we all have got a hell lot of that free fluid to qualify that as our pericardial effusion. So this is a typical case of cardiac tamponade. The heart is actually under the influence of tension from the fluid surrounding it. So the same patient also had, coincidentally, here we have what is called the pleural effusion. That's the pleural space. This is our diaphragm, and here is our liver, our gallbladder, and this is part of the pleura, and you will see there is effusion here of free fluid, and this now is what is called a pleural effusion. There's a difference between compression that is due to free fluid around the heart and compression that can happen in the thoracic cavity due to air. So when there is compression of the mediastinum by air, we call that tension pneumothorax. I'm not going to discuss more on tension pneumothorax in this particular presentation, but my main focus is for you guys to understand, to appreciate what is called cardiac tamponade. So you can see the demerits of this condition. Here you can see the left atrium, the right atrium, is appearing like a rug, and that is actually are being blown by the wind. You can see that the heart is troubled. This is our right ventricle that is actually compressed. So you see the behavior of our heart surrounded by the pericardial effusion. So this is a classical case of what is called cardiac tamponade. So this is the free fluid, a lot of this free fluid here that is actually compressing our heart. So in a nutshell, this is it. This is what we call pericardial effusion, leading to a condition that we don't like, that is called cardiac tamponade. The heart is now troubled, it's under compression, it's under tension. So it doesn't need one to be an expert of echocardiography to appreciate free fluid around the heart. So this is one of the basic things that any layman person who is trying to start a heart scan must be in a position to identify or to pick. I hope you are doing very well. Once again, my name is Mr. El Chitumba. I hope you are enjoying our videos. Don't forget to subscribe to our channel. Thank you so much.